How does T-score impact your choice of oral osteoporosis medication? Imagine your bones as a sturdy building. The T-score is like a report card that shows how strong or fragile your bones are compared to a healthy young adult. This score helps doctors decide what kind of treatment might be best for you. The World Health Organization classifies bone health based on T-scores as normal if it is above -1. If it falls between -1 and -2.5, it's called osteopenia, or low bone mass. When the T-score is -2.5 or lower, it indicates osteoporosis, meaning your bones are significantly weaker. If your T-score is -2.5 or lower, especially at key sites like the hip or spine, your doctor will usually recommend medication to help strengthen your bones. This is because lower T-scores mean a higher risk of fractures. For those with osteopenia, treatment might still be considered if other factors increase fracture risk, such as age, family history, or previous fractures. Tools like the FRAX score help assess this overall risk. The severity of your T-score also influences which medication your doctor might choose. If your T-score is very low, say below -3, stronger options like intravenous bisphosphonates or denosumab might be preferred, especially if you cannot take pills or have other health issues. For moderate T-scores at or below -2.5 but without serious complications, oral bisphosphonates are often the first choice. These include drugs like alendronate or risedronate, which have been proven to reduce fractures at the spine and hip. Sometimes, even if your T-score is between -2 and -2.5, treatment can still be helpful if other risk factors are present or if your bone density has declined over time. For those with higher T-scores but a high risk of fracture based on other health factors, treatment decisions relying more on overall risk assessments rather than just the T-score. The T-score also guides how long you might stay on medication. If your T-score is very low or you have had fractures, your doctor might recommend longer treatment, sometimes up to 10 years, with periodic evaluations. For milder cases, a drug holiday might be considered after 5 years of therapy. To put it simply, if your T-score is -2.6 at the hip and you have no fractures, your doctor will likely suggest starting an oral bisphosphonate. If your T-score is -3.2 and you have a vertebral fracture, stronger options like intravenous medication or denosumab may be better, especially if you cannot tolerate pills. Even if your T-score is in the osteopenic range, but your fracture risk is high, treatment might still be recommended. This shows how important it is to look at the whole picture, not just the T-score. In summary, the T-score is a key factor in deciding when and what type of osteoporosis medication to start. A score of -2.5 or lower usually means treatment is needed, with oral bisphosphonates being a common first step. More severe bone loss or additional risk factors might lead to stronger or different treatments. Always remember that treatment decisions should be personalized, considering your overall health, fracture history, and risk factors. It's essential to work closely with your healthcare provider to find the best plan for you.